what you need. Sit back, buckle up, enjoy the ride with Crystal Petry. Consulting, so inspiring.
Hello, and welcome to another episode of 60 Minutes With. I'm your host, Crystal Petry. Wherever you are, whatever you're doing, make sure you subscribe to my podcast right now. On this week's episode of 60 Minutes With, I am going to educate you about a healthcare facility that is actually leaving a legacy for you and your children in your community. And here to educate us about something maybe unheard of is Josh Davis. So welcome to the podcast, Mr. Davis.
Thank you for having me.
Thank you so much for getting on and talking about this, because healthcare in the community is so very important, but I feel like a lot of people, it's not on their radar.
Right. So we stay so busy that we're going.
Yes.
And it's when do we stop to take care of ourselves? Or if we stop to think about taking care of ourselves, it's how am I going to afford it? I don't have insurance. What are my resources? Where can I go?
Exactly.
And that's what we're here for.
Exactly. So you, Joshua Davis, work for Legacy Community Health. So tell us about that healthcare facility, your title, your responsibilities.
Okay, so Legacy Community Health, we are what is known as a federally qualified healthcare center. So what that means in short is we see everybody regardless of their ability to pay. Legacy's been around for over 40 years. So we moved into Beaumont back in 2012. We have 3 healthcare facilities here in Beaumont to serve the community. And we see everybody, regardless of their ability to pay. So at Legacy, we believe that healthcare is a right, not a privilege. So we want to make sure that the entire community has access to quality healthcare that is within their means to afford it.
Now, you stated that you have 3 facilities in Beaumont, Texas. Where are those facilities?
So one is on North Street, above the Wellness Center. So that is one of our pediatric facilities. Then on North 11th Street, right behind Checkers, we have our adult primary care. And then on Stag, next to the Baptist Cancer Center, we have another pediatric and our OBGYN and behavioral health.
Who is Legacy Community Healthcare for?
Everybody. So that's what we always want people to understand. So a lot of people see that we're a community health center. So people will think, well, that's for underserved or those that don't have insurance. We see everybody. We see patients that have insurance, those that don't have insurance, those that are on Medicaid, Medicare. We are here for the entire community. So it's in our name. We're a community health center focused on health for the entire community.
Okay. And if people are listening, they're watching this podcast, and you have already sold them on wanting to become a member of community health care, how could they do that? What's that process?
So the easiest way is to call the clinic, and it's 409-242-2525. And just let them know whenever you call that you're looking to schedule an appointment for whether it's adult primary care, it's OB, it's gynecology, pediatrics, and someone can get them scheduled for the next available new patient appointment.
Okay, excellent. What exactly is community health care? Because I've kind of heard it just in passing, but never really knew what it was.
So your community health centers, also known as your FQHCs, your federally qualified health centers, those are in the community, focus on the needs of that community. So they look at what's needed for that specific community and looking to reduce barriers to care, whether that's transportation, whether it's healthcare costs, anything that's prohibitive to a person receiving healthcare and offering those services. So for Legacy, we have 60 locations across the Gulf Coast, so from Beaumont to Houston, and each of our clinics is just a little bit different based on that community that we're in and what the needs are. So in Beaumont, we have all the services, adult, pediatrics, OBGYN, behavioral health. Whereas Southwest Houston, we have a bigger focus on pediatrics and OBGYN because that's a big need in that area. So we go to meet the need of the community, and also we're constantly looking at what is needed in the community, what can we expand on services, where is that access to care needed, what's missing for our community. And so it's really focusing on what is needed for that community and how can we best serve the community.
Okay, so 2 follow-up questions to that. One, what is OBGYN? I hear you saying that acronym a lot.
So obstetrics and gynecology. It's a lot to say. So
yes.
And in healthcare and at Legacy, we use a lot of acronyms. And so it's obstetrics and gynecology. So we can see patients for a well woman exam. We can see patients that are pregnant and have never gone through pregnancy before, and walking them through that process. And so we have a lot of neat services that are additional to just what happens in the four walls of the exam room, which makes Legacy really special. And that's another thing with the Community Health Center is we go beyond just here's what's wrong, here's a prescription, this is how you're going to fix this is what you need to do, come back in 3 months. We focus on other programs and services to enhance that experience and make sure we're really meeting our patients where they are and helping them to best understand. Healthcare is complicated. Doesn't matter how much education you have, how long you worked in it, it's still complicated. And so we try and make that as easy as possible to understand while providing the resources where patients feel comfortable to ask those questions that they may have.
Now, you spoke about a woman, having birth, maybe for the first time or the second time or whatever. I feel like whenever you're pregnant, it's a scary situation each time because it's a unique situation each time. How do you guys make that less scary within your four walls?
So one of the things that we do is we have a program for our pregnant patients called OB to PD. So whenever our pregnant patients come in for their very first initial maternity visit, they get what we call Chapter 1. So that Chapter 1 explains to them kind of what to expect during pregnancy. What is morning sickness, what you may experience, what you can and can't take, and just kind of how the trimesters go, and that kind of a roadmap to the pregnancy. And then when they hit their 30-week appointment, they get Chapter 2. And Chapter 2 is, okay, you're nearing the end of your pregnancy. This is what you need to bring to the hospital. This is what you need to have when you bring baby home from the hospital. This is the car seat, and kind of walking through all of that. So that way they kind of have a checklist of, what's in my hospital, go back. What do I need whenever I leave the hospital? And then Chapter 3 is postpartum. And so once they have the baby, the newborn, they get that at the newborn appointment. And so this is, you have baby now, this is what baby's going to require. These are the different visits they need. This is what you can and can't feed the baby. This is how baby should sleep. And kind of all those things that to some people may be obvious, but to others, it's not. And if you are having a baby and no one in your family's had a baby in 20 years, and your mom or grandma is telling you this is how we did it 20 years ago, it may not be the best or the safest way to do it now. And so these books kind of walk through those questions of what people may have, but think, oh, it's a dumb question. I don't want to ask that because it's something I probably should know. But it's one of those until you've gone through it, and healthcare changes. Things change constantly. And so we want to make sure that we're putting the resources in our patients' hands where it's accessible for them. And it also kind of gives them something to look through as they're going through the pregnancy. And then if they have questions when they come back for those subsequent visits, to ask that. And then another big thing that's in the books is talking about postpartum depression. Is it's real. It's nothing that's taboo. There's nothing wrong with a pregnant patient that ends up with postpartum depression, but we want to address it as quickly as possible. And not for our patients to say, I'm fine, I'll get better, I have to focus on my child, I have to do this and I have to do that. No, you have to take care of yourself. And we want to make sure we instill in our patients it's important to take care of your family and take care of everybody around you, but you also take care of yourself. If you're not taking care of yourself, you're not setting yourself up for the best possible way to take care of others.
I love that explanation, and I love that not only do you say it, but you apply it within the walls of Legacy Community Health, because when women are pregnant, and this is me speaking as a woman, when women are pregnant, I feel like so many things that we say, the questions that we ask, what we are thinking in our head or feeling in our body is just overlooked. And it's just like, oh, don't worry, you'll get over it, don't worry. But that's not the case with Legacy. So thank you.
So we don't have a cookie cutter approach. We want to make sure that everyone that walks in the door gets a unique experience unique to them. So we may get a patient that comes in that knows how to fill out consent forms and knows what it all means. Mm-hmm. But then we may have someone that comes in that says, I don't know how to read, or I'm not sure what this means. So every patient gets a unique experience based on what their needs are. So we're real big about meeting our patients where they are, mm-hmm. and not just expecting them to follow one approach. And we don't follow one approach for our patients either.
One of the things that you stated was meeting your patients where they are providing services that they need. How do you find out, and I know I'm not talking about you specifically, but how does Legacy find out what services are needed in Beaumont, Texas, as opposed to what services are needed at your clinic in Houston, Texas?
So part of it is just being out in the community. So being engaged in the community, seeing what the community needs are. Working with our local hospitals. So we have a great relationship with Christus and Baptist. Those hospitals will do community needs assessments throughout the years. And so looking at those as well. And then also just listening to our community. And if people are saying, hey, we need to have X, we need to have Y, looking at, is that something that is feasible for us to do? Can we plan for it in the future? What are the opportunities to engage in that service? And so a lot of it is just listening to what our community's needs are.
Okay. As a whole, why is a community's health so important?
Our health is important for everything that we do. If we don't have our health, then it's hard to work. It's hard to take care of our family. It's hard to get up in the morning. It's hard to cook dinner. So health is at the center of everything that we do. And so we should be focused on our community's health, because if we can have a strong, healthy community, then so much more can happen. So much more can grow in this community if we can focus on how can we get the community as a whole healthy, and not just stay within our bubbles of, okay, I have myself, I'm taking care of myself, I'm well, I'm good. That's all that matters. Well, what about that neighbor 2 doors down that may not have any family? You know, they may not be able to afford to go to a doctor. I think they can't afford to go to a doctor. But if you know of a resource such as Legacy, connecting them, saying, hey, you know, Miss Smith, have you ever heard of Legacy? You know, let me help get you connected with them. To look out for our fellow person of how can we help them as well. Because I think we just get so caught up in the moment of what we're doing that we just overlook it, and it's kind of every person for themselves. But just working to connect that community, because if we can work together as a community and stay united as a community, then we can grow and do so much more. Because if everyone's healthy and everyone's doing well, then just imagine what the possibilities are. Like we have a great community right now, but if we can enhance that community into a healthier community, what can we do with that?
Let's expound on that a little bit more, Josh. If our community is healthy, if we all come together and help our neighbor, what are some positive things that come out of that for the community as a whole?
So I think with one of the things is, you know, there are some patients that they want to work. They need to work. We all need to work. But because of health issues that they just don't know where the resources are, they work, get sick, miss work, have to find another job. Work, get sick, miss work. And it's just that repetitive cycle because they're not getting where they need to be. Whereas if we can get someone that can get connected with Legacy, so if it is some chronic illness that is maintained through medication or some sort of treatment, then we can get that patient on that path to good health, which then helps them to get on the path to living a normal life to where they can feel like they're productive and they're doing more and they're re-engaged in what they were doing 5 years ago before their health deteriorated or declined. And so that helps too. But then also just the education of health in our community is so important, because if we can educate on how to take better care of ourselves and how to get more engaged, then what we can do together with getting outside, educating on what it means to do physical activity. Just because kids nowadays, I have a niece and 2 nephews that, you know, they're kids, it's like their thumb muscles are real strong, but it's what can we do outside? And so there's so many different festivals that we have, again, that people don't realize, but getting outside and being physically active, that's also helping your health. So there's so many different ways that we can strengthen our community and to do more by just first focusing on how can we take care of ourselves, and then how can we take care of that community.
Let's look at the other side of that coin. So if our community health is not a priority for the residents within the community, what negative can come from that?
So for patients that may not have insurance, that may be those ones that are constantly having issues that flare up, and they end up in an emergency room. An emergency room is not a place for primary care issues. So we want to save an emergency room for a true emergency. So if we can get our patients and the community to understand where to go for certain needs. So if you go to an emergency room because your blood pressure is skyrocket, but you're doing that every 45 days. If you come and you see a primary care physician and you're on a maintenance regimen of, whether you're taking blood pressure medicine, that's changing your diet, whatever it may be, then you're not in that emergency room every 45 days. And it's opening up the emergency rooms for true emergencies. Because when you go into an emergency room now, there's so many people that are waiting.
The wait
and
is
there's
ridiculous.
a lot of people that don't need to be there. That they could, if they had a medical home, which is what we call it, to where they had a primary care doctor they could go to on a regular basis, they knew they could afford, then they wouldn't have to be in these emergency rooms racking up enormous bills to get what they need, but spending hours there when it's not necessary. So that's one of those things that is kind of negative. It puts a huge weight and burden on our emergency rooms when patients don't know what the resources are available to them and how to best maintain their health. Because if it's emergency, yes, we need to utilize an emergency room. But if it's for a cold or if it's for continual high blood pressure, that's something that should be monitored by a primary care doctor. And not every time it happens, ending up in emergency rooms. We want to make sure that we can engage our community in knowing where resources are and how to best engage in those resources and who to see when.
Now, of course, you are no doctor, Joshua, but give me some examples of what should be taken to, for example, Legacy Community Health as opposed to going to the ER. You mentioned high blood pressure and you mentioned a cold. What are some other examples that you might can think of that someone should go to a primary care physician, Legacy Community Health, as opposed to going to the ER and waiting for hours and hours?
So we help patients manage chronic illnesses. So whether that's cholesterol, diabetes, high blood pressure, those common things that everyone kind of thinks of as far as, it's genetic or this is what I'm predisposed to. But if you end up with, chest pain, that's not something to come to us for because we're going to send you to an emergency room. You have a broken arm or you have an accident, that's not primary care. That's going to an emergency room. So kind of your general day-to-day health is what you come to us for. Okay. Anything that is unexpected, accidents, sharp pains in the stomach, things like that may necessitate further testing would end up going into an emergency room. But it's one of those, everyone knows their own body, so it's how someone would define what they consider to be an emergency. But we just, when you're going to the emergency room for the same thing on a continual basis, what can we do to mitigate that? To where we can take what is an emergency at that moment for that person, because we're not discounting it being an emergency. If you're not feeling well, you may think it's a true emergency, and we're not discounting that. But how can we take what you feel is an emergency in that moment and make it to where it's no longer a worry and no longer an emergency, and it's something that you're able to maintain?
You stated that there's 3 locations here in Beaumont, Texas. If a person does have high blood pressure or cholesterol or something like that, does it matter which facility they go to? Is it dependent on where they live?
Not where they live, but each facility offers some different service lines. So our North 11th Street location is adult primary care. So that is for our adults. That's where you get your annual well checks. If you're going for blood pressure, cholesterol, diabetes, that is our North 11th Street. Our North Street above the Wellness Center is pediatrics. So that is for our kids. So whether it's sick visits, annual visits, sports physicals, that's where they go. On Stag, we also have more pediatricians there. So same thing as North Street. Then we also have obstetrics and gynecology, and then behavioral health. And so our clinics are divided up based on service line and not you have to go here because you live in this area, or go here because of this.
Okay. A healthcare center is considered a patient-directed organization. Explain that to me, and then explain to me why that's important, a patient-directed organization.
So it goes based on what the patients are needing, what the community needs. And so that's the center of community health centers. It's looking at what we need for that community. So if we come in and say, we're going to put this, this, and this, and it's not something that's needed in our community, we're not really helping the community. But if we come in and we know that there's a strong need for adult primary care, and we need more adult primary care providers, we're going to put those as a service line. Or if we know that we have a lot of pediatric needs, we're going to put pediatrics. So we look at what the community needs. So that's where that patient directed comes from, is the needs of the specific area at that time.
Now, you stated that, which is a very broad answer, that Legacy Community Health is for everyone. Is that really possible, that a community health center is for everyone, regardless of, I mean, what about people who don't have jobs, or, you know, they don't have money to pay, or they don't have insurance?
So if we have a patient that has no insurance, no job, they are living with a family member helps to support them, we still see them. So we have an eligibility team of specialists. So when we get patients who will come in that don't have any insurance, we have them sit with their eligibility specialists. They will go through and see what their household side is, their living situation, their income, and look to see, can they qualify for Medicaid? Are there any grants that are available they can qualify for? Are they able to get on a marketplace plan? Or if none of that applies, then we put them on what's called a sliding scale based on income. And so that sliding scale goes based on what the federal poverty level is for that bracket, and gives them a rate that they would pay. But in that instance, we still aren't going to turn somebody away. If they're just having a hard time, we're still going to see the patients.
And what about patients and clients that are on the higher end of income? Are they still able to come to Legacy Healthcare as well?
Mm-hmm. Yep. So a lot of times people will say, well, if someone's on the high level income, they're going to have insurance.
Okay.
Sometimes you have business owners, they don't have insurance, and they have a high income. They can have what would be a self-pay rate. So they obviously, on that sliding scale, they'd be at the top of that bracket. And so we see them. On the flip side of the coin, if they have insurance, there's very few insurance plans that Legacy doesn't take. We take so many different insurance plans, again, to make sure that we're accessible to so much of the community. So we're gonna work with all of our patients. So we're here for the community.
We have hospitals, obviously, in Beaumont, Texas. They have them, obviously, in Houston, Texas, and just about everywhere. Why do you feel like community health centers are even needed if we have hospitals?
Because with hospitals are there for your more serious issues. So at a community health center, we're not going to deliver a baby in the office. We also don't have the means for major issues, major medical issues. So a massive heart attack, you know, if you have appendicitis, like that's not something that you can do in a community health center. So hospitals still have a huge need, but community health centers are there to do the day-to-day of healthcare. So your well checks, your annuals, and I keep saying well checks and annuals because it's so important that patients do that on an annual basis. And we want healthcare to be proactive and not reactive. So if you do those well visits and you come in every year to do your checkups, then you're being proactive in your health. You may find, oh, my cholesterol's a little elevated. Let me do this, versus not going for 5-10 years and then ending up in the hospital and finding out that you have really bad cholesterol issues and you may have some blockages. So we want people to be proactive versus reactive with their health care. So hospitals have a huge need in our community, but we want to make sure that they serve the need that they're supposed to, and that they're not operating as a doctor's office, because we want to take that off of them so that they can focus on providing those life-saving measures where we take care of your normal day-to-day health.
And I know this is kind of one of those questions that, if we knew, but I would like to get your opinion on this. How do we get people to be proactive with their health? How do we get people to do their annual checkups, their annual physicals every year? How can we accomplish that?
So part of it is people finding where those resources are.
Okay.
So you letting me be here to talk about this today is a great opportunity so people can learn of one of the resources. There's many resources out in the community, and it's just figuring out what that resource is, where you can find that medical home. But then, being responsible to yourself of, whether, how are people do it? If you do it at the beginning of the year every year, getting your annual. If you do it to where it's in your birthday months, that way you remember that you need to do it every February or every March. But finding the way to do that. But then, we also, we switched to a new medical record system that we have a portal for our patients. So it's an app on your phone, and it'll show you're due for your annual visit.
It's a reminder?
And so in the app, it'll tell you.
Yes.
So that way, it's another way to hold you accountable. Because, if we schedule an appointment for next year, we don't know what's going to happen next
Right.
March.
And
We
you're
don't know
probably
what
going to
we have
forget
going
about
on.
it.
Yeah.
Yes.
And so we can plan that far out, but sometimes it's hard to remember or to keep up with it because life happens. And so this way, our new medical record system, that app, is another way to help remind patients of, hey, you're due for your annual physical, you're due for this, your flu shot is due. So it's just those little reminders that will kind of ping you of, this is what you need to do. But then it's also stopping long enough to take care of ourselves, because we do stay so busy. And I'm guilty of it. I run, and then it's like, I need to do this.
Yes.
Because if we're not taking care of our health, then I'm not going to be running
Right.
for very long. So it's hard to do it, but it's reminding ourselves that we have to stop, take care of ourselves, and see what is needed. And as we age, there's other different preventative things that we need to do, and so it's following up with those too. So that's something that our providers will ask. When did you go to the dentist? Because dental health is important. When was your last colonoscopy? When was your last mammogram? When was your last pap smear? When was your last PSA? And making sure that our patients are staying up with that. Because we don't do colonoscopies, but we can refer patients out for colonoscopies. And just making sure that they're staying up to date with that and looking at family history. So, patients will say, you'll ask a lot of questions. And we do ask a lot of questions because we're trying to find what your needs are for your health. And sometimes it's not necessarily just you, but what your family history is. And if you have a family history of something, there may be a certain preventative test that you need to do just to stay on top of it. So we do ask a lot of questions, but it's for the best interest of our patients and finding out how to best serve our patients.
And you used an acronym, PSA. What does that stand for?
That's your for prostate, for males, for the prostate screening.
Okay.
And all of those, and the ages change on them, so I don't quote me on them, but they all have different ages on what is medically recommended. At this age you start a mammogram, at this age men do a PSA, at this age you do a colonoscopy. But those ages aren't concrete in the sense of if you have a family history of something, or if you have something else that would necessitate getting that screening, then you would follow those recommendations.
You stated, was it 2012 that Legacy Community Health came into Beaumont, Texas? Okay, so and I'm sure you guys did your research and maybe did assessments as well of the community, but what brought Legacy Community Health to Beaumont, Texas in 2012?
So before we came to Beaumont, we had locations in Houston. We had a location in Southwest Houston that we got connected in that area by way of Christus. And so we had that clinic open in the Southwest, and then there became a need in this area. So Christus and Beaumont had approached Legacy and said, hey, there's a need to open a community health center. So we came into Beaumont working with We Care House and opened a clinic in the South Brook area. And so we were on Highland from 2012 until 2018. And then we had to make that difficult decision of we had just outgrown that clinic so much. There is a bigger need for services than what that building could accommodate. And that's when we moved into our STAG clinic. The STAG allowed us to enhance our services by adding more providers, which provided more access to care, opened up more doors to resources for our patients. So we had to leave the Southport neighborhood, but we still serve the Southport neighborhood. And so we go back into South Park and doing different events and activities. So we do our annual Back to School Festival in South Park because there is a huge need for that area. We do want to serve that community as best as we can. We still provide health care to them. It's just we're not on Highland anymore. We had to move on to Stag, which puts us more in what you consider like the hospital district of Beaumont. And so we're close to grocery stores, we're close to pharmacies. So we're accessible for someone that may need public transportation. So that way, if you have to take public transportation to get to Legacy, then you can also go to Legacy, go to the grocery store, and kind of, you're not just going to a doctor's office and having to take another bus to go here and then go here and then go here. So that way we're trying to make sure that, again, we're best serving the community, make it as easy as possible for them to get to us.
And as myself outside looking in, I felt like that was a good thing that you guys outgrew where you were on Highland because you had your patients coming, which is a great thing, which is what we want.
Right.
But how did the community feel when you had to move to a bigger location? What was their reaction?
So it was a difficult move just because a lot of our patients that we had some would walk. We lived in the neighborhood, so it was right down the road. And so that's why we made sure that where we moved, there is transportation, there's access to that. Mm-hmm. And we work to educate the community on this is how you can get to us, we're not leaving you, we're still working to serve this community. And then We Care Tells actually, they also stepped in and say they have some adult primary care services they offer as well. So there's still some health care in the community. But for legacy services, we moved over to Stag on 11th Street. But we still work with the patients to make sure that we can connect them to get them into the clinic. And then another thing that the pandemic kind of opened the door for is in 2020, we did what everybody did. And we had to flip a switch almost overnight for telehealth. And so now we offer telehealth visits. So we have clinicians or doctors that some of them have a day of just telehealth. And so they have their entire day is all telehealth visits. And again, through any medical record system, instead of having like a Zoom visit or having to do through one of those platforms, it's within that app.
Yes.
And it's called My Chart for the patients. And so when you click on Start My Visit, and then it'll put you into the virtual waiting room, and then you do your virtual visit with the provider through that. So that's also helped a lot because there's some patients that if it's just a follow-up, that may not need them to physically come into the clinic, then it can be done through a telehealth visit.
Yes.
And so that way, that's another way that we were able to kind of meet the needs of the community is by offering telehealth. Telehealth is one of those things that we were kind of pushed into it because of the pandemic, but it was a good push because it really helped us to meet the needs of our community to where we're making healthcare more accessible, bringing it to their living room versus them having to come out. Because I mean, if you're taking care of a parent, you have kids, working, yeah.
Yes.
So there's so many different barriers to healthcare that we don't consider as barriers. But if you don't have a babysitter, if you're taking care of an aging parent, if you're working and you can't get away for more than 30 minutes, you can take your lunch break and go sit in your car and do a visit. And so then it makes it to where there's really not an excuse to say, I'm just going to put that off for a few months. So we try and, again, be as innovative as possible to meet the needs of our community.
So with the telehealth, basically you're saying you can have a doctor's visit from your cell phone.
Mm-hmm. And we do that for all of our service lines.
Okay.
So pediatrics, now obviously the OB/GYN.
You got to go in for
Got
that.
to go in for that. But if it's just a lab follow-up, those are things that you don't necessarily, there's no physical exam involved. Adult primary care, and then even behavioral health. So with our therapists and psychiatrists, it's proven to be really effective because sometimes you get nervous going to a doctor's office, you get nervous going into a hospital. And so it's hard to open up. Whereas if you're sitting in your living room on your couch, you're at home, you're in your comfort zone.
Yes.
It's not a weird space. And so it's proven to be really effective because a lot of times patients will get what they call white coat syndrome. So it's getting nervous going to the doctor's office. And you go and you're going for this, this, and this, and then the doctor walks in and you're like, and it just, you forget because you get nervous. Whereas if you're at home, it's more comforting. And again, it's something our staff does. So when you schedule an appointment, we're going to ask you, what are you coming in for? Whenever you get to the doctor's office and the medical assistant is rooming you, they're going to ask you, what are you coming in for? So you get asked multiple times, and it's not because we're not writing it down and we're not forgetting it, but it's those multiple layers to make sure that we can ask those questions, that we don't miss anything. So my grandma is the world's worst at saying, I already said that. I've already told them that. But it's making sure that we're able to meet all your needs. Because our providers and our doctors are very smart, but they can't read minds. And so they can do a lot of assessments, but sometimes they don't always know what you need because it needs to be communicated out.
Right. You stated that you guys do a back-to-school annual event. Tell me about that event and some of the other community-involved events that you have.
So back to school happens every July. It's usually the last Saturday in July, and we're in the stages of planning that now. Going back to Peach MacArthur, so on Highland. And we started it back 2 years ago. So during the pandemic, we would just do backpack distribution through the clinic. Before the pandemic, we do a back-to-school event. And then, so as we kind of moved out of the pandemic, I'm a big idea, big goals, big event person. And so I wanted to really hone in on that. Kids need backpacks.
Yes.
But kids also need families need resources. So part of going back to school, you get haircuts.
Yes.
But also to make it fun for these kids. So a couple years ago, we did 300 backpacks. And in their backpacks that have your backpack, your crayons, your markers, your pencils, your notebook paper, your spiral. So we try and put as much of the necessary school supplies. So that way, with that backpack those kids get, they're ready to walk in on day one and get started with school. Because if they don't have the resources they need for school, they're starting.
Endurance.
Yes. And then it takes that burden off of mom, dad, grandma, whoever may be raising the child, of trying to go do that. Because, I mean, I remember growing up, you used to be able to get notebook paper for a penny.
Yes.
And it's not the case
so
anymore.
expensive now.
Everything's so expensive. And so going back to school is very expensive. If you have one child, it's expensive. If you have 2 kids or more, then it's so expensive. And then clear backpacks is what school districts want now.
Yes.
Those are expensive to get.
Yes.
And so we try to make sure that we can provide that. But then also, it's you know what you know, you don't know what you don't know. And so there's so many resources our community offers. So Legacy is a United Way partner agency. So we get some funding from United Way, but then we also work very closely with those other partner agencies. There's no need to do all the work and try and solve all these problems when we have all these resources out there that are also doing that.
Right.
So playing to our strengths of, we're really good at healthcare, but then there's this service that we can refer our patients out to. So we invite those partner agencies to come to the event and to share those resources. And then we do fun things with the kids. So we do snow cones and popcorn, and we do face painting. We bring up the sheriff's office. This past year we had the local FBI office come out. And it's neat things for the kids to see. But then it's also building that trust with those kids. Firemen aren't scary.
Right.
The police aren't scary. So building that trust. And then like there's a couple that does reptile experiences at the Children's Museum. So they come out, let the kids interact with these big snakes and different reptiles. So it is a learning experience that is fun for the kids, but then they're getting what they need. They're getting haircuts, they're getting ready for school, and then parents are getting resources, not just of what Legacy offers healthcare-wise, but other resources in the community that can be offered that can help them on a day-to-day basis.
And that's so important because when kids go back to school and they don't have the supplies, you start the school off horrible. There's that embarrassment factor there because you don't have your pencil or your paper or your backpack, and all of that is such a hindrance to learning. You want me to learn these timetables and read this book, and I don't have a backpack, and I don't have a pencil, and I don't have paper. So, I mean, most people would think that's nothing, but that is huge for a child going back to school.
Yep. And, education and health are hand in hand. And so that it kind of goes into another program that we have. So we focus on healthcare, but literacy and education is a huge part of healthcare, and that people don't necessarily realize. And so for our kids, we have a literacy program called Little Readers. So whenever our kids come in for their well checks and their annual visits, from newborn until 18, they get their age-appropriate well check, and at the end of the visit, the doctor gives them what we call a prescription to read. So that prescription to read is not an actual prescription for medication. It is a book. And so the books are age-appropriate. For the kids, they get to pick out a book. For our, starting with the newborn, they're the little cardboard books that, a newborn's not going to read a book, but the communication of parents and siblings talking to these babies and just that communication back and forth is so important developmentally. Plus, in looking at with literacy and books, when you look at a low-income neighborhood, it is 300 kids to one book. Whereas if you look in a middle-class neighborhood,
Is that true?
it is 13 books to one child.
What?
So for a lot of our patients that we see, for our kids, we're building this library of books that they would never own. Because, parents may struggle to put food on the table, much less be able to buy a book for them. And they have libraries at schools, but libraries are also one of those things that people just don't go to a library anymore. People aren't utilizing libraries for what their purpose was. And so we try and put these books in the hands of kids so that way they get excited about it. We build a love for reading for them. And by building that love for reading, we're boosting that literacy for them. And that literacy is going to help to boost health outcomes. Because if you think about it, if we're not helping to boost that literacy, when those kids become adults and they have trouble reading a prescription label, that's a hindrance to healthcare. Or they don't know how to read the after-visit care summary that they get when they go to the doctor, is a hindrance to their healthcare. So we try and, again, fix these issues before they become issues, and in a fun way for these families.
Yes.
Plus, it allows these kids to engage with their parents and their siblings, and it's, 7-year-old, read 30 minutes a night, read to your mom and dad, read to your baby brother. So then it's also building that family time around it, where reading's not a chore, it is something fun to do.
And one of the things, as we were, setting up the books before the interview, that I noticed and I love is your books are so diverse.
Yes.
So you're catering to everyone, not just one type of child. So you can see yourself in these books. We have, African American kids on the books, but we also have the books are transcribed in Hispanic or Spanish language as well. So you are meeting the need for every child.
Yes.
In the way they look, the way they talk, the way they sound through your literacy program.
It's back to Legacies for everyone.
It's back to Legacies for everyone.
So we're very focused on making sure that everyone can see themselves at Legacy.
Yes.
And so that it's not, that's not a place for me. Nope. We are representative of the community. And so our staff, one of the things I get super excited about is our staff that works at Legacy are all part of our community. we have staff that truly care about what we do, and that we're not coming to work just for a paycheck, but we're coming to work because we love what we do, we love our community, and we want to make the best of our community. And so I can't speak highly enough of our staff and the work that they do day in and day out. And there's lots of people that make the job happen. From our front desk, to our medical assistants, to our lab, to case managers, eligibility, IT. There's so many people that make it happen every day that don't do it to be thanked. They do it because they love what they do, and they're there for a specific reason. And so it's really, I've done for-profit, and then I came to nonprofit, and it's like, oh, I love for-profit, and it's like, this is what I love, because it's, we have a job to do at the end of the day, but in doing that job, we're taking care of the community, and we're making sure that we're in the community, learning what the community needs, meeting those needs of the community with the staff that is so invested in doing that because they're part of that community. They may go to Legacy, their kids may go to Legacy, their mom, their grandma may go to Legacy. And so they're invested in that because they are part of the community that we're serving.
It's like a dream team over there at Legacy.
I like to call it that. So we've going through the pandemic healthcare, it was hard for those staff that were on the clinical side. That were day in and day out working through the pandemic and taking care of our sick patients and still having to take care of their families. And so, it's hats off to them. So I was in a position to where I did some work from home, which is not for me. But it was to keep the clinic safe. We had just our clinical staff there. And I mean, they work their tails off. And they continue to work their tails off every day. And so you can't speak highly enough of the staff that we have and the job that they do, but just healthcare staff in general.
What are some other community-minded events that you guys have? I know you have the back-to-school event, you have the literacy program for the littles. What are some other community-minded events?
So our other big event we do is in December. We do a holiday party. So we have a pediatric holiday party that years ago we did it just in the clinic. We would have a day that we'd have Santa come, we'd do cookies and gifts, and I wanted to make it more of an experience. I didn't want to be going to the doctor's office to see Santa. And so as we came out of the pandemic, I used that as an opportunity to bring in community partners that we have, and those that focus on also giving back to the community and partnering different businesses that would help to make this event bigger. And so we went 2 years ago. We did it at the Beaumont Children's Museum.
Okay.
Which was a fantastic event. Let the kids be able to see the museum and experience that and get a gift, see Santa, do a craft. And then this past Christmas, we did it at Peach MacArthur. So we used more space.
Okay.
Had more activities for the kids. Had Santa, had the Grinch made an appearance, did crafts, cookies, popcorn, kind of all the holiday festive things that happen. And that's one to just make an event for our community, give something fun to do. But on a deeper level, there's so many kids that don't get to experience holidays, get to experience Christmas.
True.
Because families struggle. And so this was a way for them to get that holiday experience. So when they go back to school in January and it's, what did you do over the holiday break? They have something to talk about. So again, going back to focusing on the health of the child. It's not just physical health, we focus on all aspects of health. But then also for the families. So making it to where it's kind of easing that burden of these families that may not be able to do that full Christmas for the kids. So they're able to still have that experience. Do a family photo with Santa, get the kids photos with Santa, have a fun morning to where they get in the holiday spirit. Because sometimes it's hard to get in the holiday spirit.
It is.
And we try to bring that back, but also tying in, this is services that we offer. So we were able to get a captive audience while we're there. So we're talking to the families as they're there coming to the event. And we have our partner agencies from United Way that will come in too. So we're making it fun, but also at the same time we're still connecting the resources and what's available in the community. So it's a fun event, but it's also educating them on what they need resource-wise and how to connect them to those resources.
The Christmas event in December, the back to school event in July, the people that come to those events, do you have to be patient of Legacy to come and enjoy those?
So they're open to the community.
So anybody?
So for holiday party, we had close to 600 kids last year came through. Back to school, we had 1,000 kids come through that were represented of 59 schools, 10 cities, multiple counties. So we serve a huge area for Legacy. So we're in Beaumont, but we're not just serving those living in Beaumont. We serve people that live north of Beaumont in Hardin County, Lumberton, Coons, Silsbee, Orange, Port Arthur. We serve the entire Southeast Texas area.
So anyone that wants to come to the back to school event, the Christmas event, whether they are patients or the mom or dad or patients or not, are welcome to come to those events.
It's a community event, so it's all about connecting the community. So, as much as we'd love to have everyone that come become a patient, some people may have a medical home already, but they may still have a need for school supplies or to get that holiday experience. And so we're not going to turn that away, but we want to connect them. There may be other resources we can connect them to, because our goal will be this 1,000 families that come in, they all leave connected to Legacy. But that's not going to be the case all the time. But if we can maybe help them connect to another resource, then we did our job. It was successful in that aspect. Because they may not need to come to Legacy, but their neighbor may need to come to Legacy. Their aunt may need to come to Legacy. And so they can still connect to those resources, to where if we can just be able to educate, that's our goal, to educate and to provide a service.
I know that I'm supposed to be non-biased because I'm the interviewer and I'm interviewing you, but the way that Legacy thinks beyond surface is amazing and almost unheard of in healthcare, not just in healthcare, but in so many different industries. When people, they plan out things and they think out things, they only think about the surface. They only think about what they can see right now. But with Legacy, you guys go so far beyond the surface. It's kind of like good customer service. We're so used to bad customer service that when we get good customer service, we don't know how to react. It's the same thing with Legacy, how you guys think so far beyond the surface, and not just right now, but you're thinking in the future how the reading program will help 10, 15 years later. It's amazing.
There's so many layers to healthcare, and
yes,
people just look at the surface of my physical health, and that's it. But there's so many things that factor into that health that we try and find where we can meet those needs and kind of get in, and that may be an entry point to build somebody's health. And so everyone's different. And that's another thing at Legacy. We recognize that everyone is different, everyone is unique. There is no two of the same. And so we try and make sure that we pass that out into the community, that we see that everyone is unique and different, and we want to treat everyone how they want to be treated.
Yes. So this is a two-part question for you, Josh. What is the goal for Legacy Community Health in the healthcare field, and what is your personal intention in this field as well?
So our goal at Legacy is driving healthy change in our community. Okay. So that it's very, very broad, because healthy change is very broad. So that's connecting people to resources, getting them in for the preventative, getting people on maintenance for chronic illnesses, getting to people just to a healthier state. And so our goal is to be that beacon in this area that can provide the health care for as many people as possible, and letting them know the services that we offer. And it's one of those, we get a lot of kids that come in, and it's, Mom, when was your last well check? Well, it's been 5, 6 years, he's 9 now, so when I have him. And our goal is to take those individuals and connect them to healthcare. So then we're bringing them in to focus on their healthcare and make health a priority. Because again, I said it earlier, we see healthcare as a right, not a privilege. So it shouldn't be that only certain people get access to healthcare. Everyone should get access to healthcare. So our goal is connecting everyone in our community to healthcare. And for me, I'm a huge community advocate. So I was born in Beaumont. I love Beaumont. So many people were born in Beaumont and try to hit the fastest train out of town.
It's true.
And
it's true.
There is so much potential in our community that I love seeing what I can do at Legacy to help affect that change in our community and to help build our community up and connect our community to such a great resource that some people don't realize. So, I've been fortunate to always have access to healthcare, but I've also, I grew up in a household where my parents struggled, paycheck to paycheck. And so I see both sides of the coin of how important it is and, sacrifices that my parents made. And so being able to connect families to this resource so that way they're not having to figure out, do I put food on the table tonight or do I go get my well check? Because that should never be a question. And so we don't want to do that. And so for me, a personal goal is just making sure that the community I live in, that I'm doing the best I can do to connect them to all the resources that are available. They go beyond just Legacy. Because like I said, we offer a lot of resources, but there's so many other resources in our community that we connect patients to on a daily basis that I didn't realize when I started at Legacy. And I've learned over the years. And it's one of those things. We stay in our bubbles of what we're used to. Most people have their routine of go to this school, go to work, go to the grocery store, go home.
Yes.
And you have your path that you stay in, and you don't always realize what's out there. And it's so hard to get to where everybody is. And so one of my goals is to bring those resources to people by way of some of these events that we do.
One of the resources that, of course, is needed is dentistry. Does Legacy offer dentists within some of the resources that they offer?
So we don't have the dental services in Beaumont, but we do offer dental services at Legacy. So our closest dental clinic is going to be in Baytown. So we do offer it, it's just it hasn't been a service that's made it into Beaumont yet. So like Legacy, we have a wide array of services that we offer. Dental being one of them, it's just it hasn't made it into the Beaumont area.
Does Legacy offer primary care physicians? And I'm asking because normally whenever people go to doctors or whatever, they want to see the same person because you establish that trust, that rapport, or is it set up that whoever is there and can get you in faster, that's who you see?
So for annual, so we want our patients to have their primary care physician or responsible provider. For your annual visits, you're maintaining your chronic issues that you may have, your well checks, all that stuff. But if you wake up on a Tuesday morning and you're sick and you need to be seen, and your doctor is out of town or schedule's fully booked, then we have other providers that we can get you in with. But for the maintenance of your annual health and your chronic issues, we try and keep that continuity of care with the same provider. So you will have your primary care provider, but if you wake up sick and your primary care provider is not available, then we can get you seen with another provider for that sick visit.
Okay. What is the wait time? I'm specifically talking about new patients that are coming in, that are signing up. What is the wait time for them to get in and be seen?
So it varies based on the timing. So like right now for adult primary care, we're within 30 to 45 days for a new patient appointment, which is on the lower side because we've been higher than that, and it's because there's such a need in this area. Pediatrics, we typically same day, next day. Pediatrics, we have a lot of availability, and then with pediatrics on the first and third Saturdays of the month, we also do a Saturday clinic. Kids need a well visit, need sports physical, either immunizations.
On the Saturday?
Instead of pulling them out of school, we do Saturday. 2 Saturdays a month.
That is huge.
So adults is always a longer wait.
Yes.
Pediatrics, we have more availability. And then behavioral health, that's always a hard one because it's such a huge need. There's not enough providers for the need that we have. And so for new patients, we currently aren't taking any what we call external referrals. So patients that weren't referred by a legacy provider.
Okay.
Only because our internal referral base was so big that we didn't have enough providers to meet the needs. And so rather than having people call and put them on a wait list, it's not something people can put on a wait list for months for.
Yes.
And so for behavioral health, we're close to external referrals right now, just doing internal referrals.
Okay. And do you know maybe when that's going to become available again, or you're not sure?
I'm not sure.
Okay.
And because it's getting the provider base. And
right.
sometimes it's hard to get the providers.
Right. Again, if someone, as people are listening and watching this podcast, they want to become new patients of Legacy, they want to maybe, leave their primary care physician who they're with now and switch over to Legacy, how can they do that?
So calling 409-242-2525, that'll connect them with one of our schedulers, and they can tell them, hey, I want to switch and meet my adult primary care at Legacy. I want to move my kids over to Legacy. I'm pregnant. I want to make an appointment for a maternity visit, or I have my well woman. I don't have a gynecologist. I'd like to switch over there, and just kind of letting them know what services we're looking to schedule for.
Okay.
And then they'll ask them, going through kind of the process of, what their insurance is, and if they don't have insurance, getting them scheduled with our eligibility.
Okay.
So that way we can get eligibility done before the appointment and get that patient set up on their roadmap.
Okay. Now, this is something I think is just absolutely amazing. Medicaid has recently started, let me read this so I'll make sure I get it right. Medicaid now offers 12 months post-pregnancy services for new and current moms. So amazing.
It used to be 60 days.
I know.
So it's 2 months, which...
So explain that and tell why that is such a great thing.
Okay, so I'm going to read a little bit too.
Okay, go ahead.
That way I get the details right.
Yes.
So it used to be 2 months.
Mm-hmm.
So now it's 12 months. So those
Yes.
moms that are still within that 12-month window of having delivered can get their Medicaid reinstated.
Yes.
So they have that for 12 full months because as you're going through postpartum, after you have the baby, things may still arise. Mm-hmm. It's not that after 60 days you're good and you're ready to go.
Everything's perfect.
And so it's a huge win for our patients in our communities.
Yes.
For these moms to have access to 12 months of coverage after their delivery day. Because if you look at the stats, so healthcare advocacy groups learn that Texas ranked 14th in the nation, or highest number of maternal deaths per 1,000 live births. So that's not a statistic that we want to be proud of. And so this will help us to reduce that and get these patients resources they need.
Yes.
Because they're no longer thinking, okay, I just don't have coverage anymore. I'm out. I'm just not going to the doctor.
Yes.
Because postpartum depression is a thing. And we don't want our patients to say, well, I don't have insurance, I can't afford it. I'm just not going to do it. Legacy would still see them, but this way now they have access to Medicaid to where they have that coverage, they have that peace of mind that for 12 months, they can still get all the same coverage they had before.
Yes. It's just so amazing because anything can happen after you have literally brought another human being into the world. Anything can happen after that. So this is such a safety net that is so needed.
And it's one of those, so we have a person on our staff that does advocacy and goes to our state legislator and pushes for these things. And so this was one of our big focuses, is because we see our patients that would have it and then lose it after 60 days. And the need was so great that to see this come to fruition, it's been amazing because we can see on a daily basis, our community that's going to benefit from it.
Yes. What does quality health care mean to Legacy Community Health?
So quality to us means that everyone has access to health care. That it's not you come in and you see a doctor. The doctor tells you that your cholesterol is high, you have high blood pressure, and you're pre-diabetic, and you're going to take this, this, and this. And then you leave to go to the pharmacy and realize, I can't afford that. That's not quality. Quality to us is you go to the doctor, you may get this diagnosis. The doctor works to connect you maybe with a health educator that's going to give you some education on healthy eating. Give you those prescriptions, but also connect you in a way that it's affordable for them. If you get a prescription that is not affordable, we have prescription assistance coordinators that can work with you to see if they can get that cost lowered through pharmaceutical companies. If you come in and you're struggling finding access to food or other resources, we have social workers. So we don't just have nurses, medical assistants, doctors, front desk. We have so many other resources, so that way whenever you leave our location, your visit is complete. It is truly complete. We don't want to leave you to where you need to go here, go here, go here. So even if we do labs, we have labs on site. So rather than saying, go take this to the lab down the road, we're going to walk you down the hallway, ask you to have a seat,
Yes.
go to your labs, check out, get your next appointment scheduled, and then you're free to go.
Yes.
So we want to make sure that we close that loop on those visits, so that way we're not giving you a list of things to do afterwards. And we're, again, connecting you to the different resources and making sure that when you leave, you feel comfortable, knowledgeable, and you don't have any questions. So that's quality healthcare to us.
I understand that a lot of the onus is on the nurses, the doctors, the admin, the IT for the entire healthcare experience. What can the patients, whether they're current or new patients coming in, do to enhance their own healthcare experience?
So one thing is to always tell people ask questions. There's no dumb question. Because a lot of times people come in and they don't want to ask because they don't want to feel like it's a dumb question. So it's always good to engage. Be an advocate for your health, asking those questions that you're not sure of. If the doctor uses a word that you understand, ask about it. If you're filling out a consent form, you're not sure what it means, ask about it. Our staff is there to help. Also, just because we do see so many patients that come through, sometimes things may get a little backed up. And so if a doctor is with the patient and it takes a little bit longer, their schedule may slow up a little bit. And so, also just give that grace to that front desk staff, because they're not the ones that are controlling the times. And also to the medical assistant that's going to room the patient, because our doctors are providing the best experience to everybody. And so we want to make sure that, again, our patients sleep what they need. And so sometimes there may be a little bit longer of a wait. It may not be if it's 12:15, you walk in at 12:15, you're seen at 12:16, and you're out. We would love that to happen in a perfect world, but things happen. And so, just a little bit of grace always goes a long way. But I think probably the biggest thing is just asking questions, being engaged in your healthcare. That is the best thing that someone can do, because so many people are just like, I don't understand it, I'm not sure what to do. But we want you to understand it. We want you to be a part of it. We want you to be active in that discussion. So a doctor's visit should never be a one-sided conversation. It should be a two-sided. And so, again, it goes back to us asking a lot of questions, trying to engage as much as possible to learn about you and to see what your needs are and how we can best help you.
Okay. Well, as we get ready to wrap up this interview, Josh, I have a couple more questions for you, then I'm going to let you go. In your world, in Joshua's world, if there is anything about healthcare you could change, what would that be?
It's such a big question.
It is.
I think it would have to be just that everyone knew where they could go for healthcare.
Okay.
Everyone could have access to that healthcare. That it was affordable. affordable for everyone. Just because so many people say, I just can't afford it. I don't even try.
Yeah.
And it makes me cringe when I hear that, just because, one, it's not the case, because there are resources out there, but it's just people don't always realize that. And, we can be standing at every street corner shouting to the rooftops about it, but we're still going to miss one or two people. And it really hurts when you see someone that is struggling that says, I just gave up. And that's where, we can always do more. And so if I had one thing in healthcare, it was to where everyone knew where they could access healthcare, how they could access healthcare, and that it's a possibility.
Yes. And you, sir, have my vote. You have my vote on that answer. Okay, so my final question for you, Josh, who do you think would make a great guest on the podcast, but you have to help me get them on?
So obviously I am biased towards education and healthcare. Okay. I love what this organization does. I'm on the board for it, the Beaumont Children's Museum. Okay. So Amanda Yarbrough's executive director has a wealth of knowledge of also programs and resources that are available for our kids in our community that some people don't realize, that we have a phenomenal children's museum. So Amanda Yarbrough needs to come and share all the good that the museum does.
Well, thank you. And thank you so much for sitting down with me on this podcast. And I could just sense and feel your passion about healthcare and healthcare in the community.
Thank you so much.
You are absolutely welcome, sir. And thank you for tuning in, watching, and listening. You can get this podcast and all of my other podcasts on YouTube Podcasts and Apple Podcasts. And remember, you always have time to listen and learn on the go.
Come on, let's go on a journey. Sit back, buckle up, enjoy the ride.